Hi, I'm Dr. Joseph Cachuela, an ENT head and neck oncology surgeon at Double Doctors Hospital. Today, we will be talking about head and neck cancer and answer some of the frequently asked questions. This is in celebration of the Head and Neck Cancer Consciousness Week, which we usually celebrate at the 4th week of April. So, what is a head and neck cancer? Basically, any malignancy in the head and neck region except the area of the brain, spine, eyes, and dentition. These areas are handled by our neurosurgeons, orthopedic surgeons, ophthalmologists, and dental specialists respectively. Head and neck cancer usually spread in the neck lymph nodes, and most of the time, this is the first and only manifestation of the disease, presenting as neck lumps. What are then the risk factors in developing head and neck cancers? The two most common causes and well-studied risk factors are smoking and alcohol. If you are smoking, the risk is 5 times. And if you are a smoker and alcoholic at the same time, the risk in developing head and neck cancer increases to 15 times. These two risk factors are synergistic with each other, producing a greater combined effect. Other risk factors include sun exposure, viruses like HPV and ABV, radiation exposure, industrial exposure like nickel and asbestos, exposure to food preservatives, alcohol-containing oral solutions, and among others. Now that we have an idea of head and neck cancer, what are then the warning signs of head and neck malignancies? What are the symptoms of head and neck cancer? Generally, symptoms depend on which area of the head and neck is involved. In cases of oral cavity cancers, they usually present with ulcers, white or red lesions which we term as leukoplakia or erythroplakia. Sometimes they present with bad breath or halitosis and even trismus. Nose and paranasal sinuses generally presents with nasal obstruction, chronic rhinorrhea with foul-smelling discharge, and usually not responding to antibiotics. Sometimes they present with epistaxis, anosmia, headache, and even dental pain and tearing due to lacrimal duct obstruction. Salivary gland malignancies, aside from lump as initial presentation, malignancy on this area usually presents with facial paralysis and pain. Manifestation in the pharynx usually presents with pain, choking, and difficulty in swallowing. If the area involved is your oropharynx, which is in direct proximity to your nasopharynx, sometimes patient will present with ear fullness, ear pain, and hearing loss. Your nasopharynx, which is located at the back of your nose, patients usually present with ear fullness, ear pain, and hearing loss. They also present with nasal obstruction, rhinorrhea, epistaxis, anosmia, and even headache. Laryngeal cancers usually present with hoarseness, difficulty of breathing if the mass is huge enough, causing airway obstruction, and even hemoptysis. Neck masses is the most frequent reason of head and neck cancer consultation. If the said mass is enlarging, painless, hard, and fixed, these are features suggestive of malignancy. Best if you consult your doctor for full evaluation. How do we diagnose head and neck cancer? Usually by history and physical examination, or by doing endoscopic evaluation using rigid or flexible telescope, or by doing biopsy, which is a very essential step in differentiating the type of malignancy, or by various imaging studies which includes your CT scan, MRI, ultrasound, X-rays, PET-CT, and among others. How is head and neck cancer treated? There are various treatment options for head and neck cancer. The choice of treatment is being influenced by the biopsy result as well as the stage of the cancer. Treatment can be unimodal or multimodal. Unimodal means single treatment, either surgery alone, radiation, or chemotherapy. Multimodal, on the other hand, means combining two or more treatment options, like surgery plus radiotherapy, or chemo plus radiotherapy, or surgery plus chemo plus radiotherapy. But generally, most head and neck cancers are treated with surgery. This is the recommended follow-up schedule by the NCCN guidelines. For the first year, every 1 to 3 months. For the second year, every 2 to 6 months. For the third to fifth year, every 4 to 8 months. And sixth year onwards is every 12 months. If you have these symptoms, best if you are evaluated by your doctor. Consult if you have the following: epistaxis, nasal obstruction, chronic rhinorrhea, hemoptysis, mouth ulcers, halitosis, frequent throat clearing, lump on swallowing, dysphagia, hoarseness, ear pain and tinnitus, as well as neck masses. Head and neck cancer is treatable, especially if caught at early stage and appropriate treatment is given. So when in doubt, consult your doctor. Visit us at Double Doctors Hospital. Good day and stay safe.